The last section we are going to highlight in the Social and Economic Factors chapter of the 2023 Davis for Health Community Health Assessment focuses on housing. Housing information can be found starting on page 216, and there is more data available on page 260 in the Physical Environment chapter. Additionally, the Davis County Housing Environment Assessment was just released with more in-depth data. Housing and health are deeply connected. An affordable, safe, and stable home is a basic need and is essential to good health. The health of the housing environment in Davis County can be described by the 5 A's: affordability, availability, accessibility, adequacy, and assistance. Housing is considered affordable when households pay no more than 30% of their income towards housing costs like rent, mortgage, and utilities. Home prices have increased 122% in a 7-year span, and rent prices have increased 89% in a 2-year span. However, household income is not keeping pace with these increasing housing costs, especially for renters in Davis County. More people want to live in Utah and Davis County than there are available homes. This lack of availability is being driven by rapid population growth, a low inventory of homes for buyers and renters to choose from, rising interest rates, and the cost of materials for new builds. Households that have lower incomes have the least housing options available to them. In Davis County, an estimated 9% of people are living with at least one disability. Housing is considered accessible when individuals with disabilities can easily enter a home that has features to help them live independently. A 2021 housing survey conducted by Davis County showed that 9% of respondents had experienced housing discrimination, and 7% indicated that the housing provider refused to make reasonable accommodations for a tenant with disabilities. Accessible housing is also when housing is close to an employment, grocery stores, schools, and other needed services. For housing to be considered adequate, it must be safe, decent, and livable. Strengths of Davis County homes are that they have safe drinking water, adequate sanitation, energy for cooking, heating, cooling, and lighting, and rarely have toxins or environmental hazards such as lead, asbestos, mold, and carbon monoxide. Assistance through federal programs allows people with low incomes the ability to access housing. Examples include housing choice vouchers, public housing, and project-based Section 8. Low-income housing tax credits provide an incentive to build and maintain affordable housing. Since people who are very low income have the most difficulty accessing housing, it is important that these types of affordable housing are preserved. Another federal program provides support for students experiencing homelessness so they can remain in school. You can learn more about barriers to housing, assistance resources, and homelessness by visiting the Davis County Health Department's Reports and Assessments page, which is also where you can find the online version of the CHA and the new Davis County Housing Environment Assessment. Stay tuned to learn more about the health of Davis County. You can access the CHA online at cha.davisforhealth.org. Please send us an email if you have any questions.